Hello and welcome to McDougall's Medicine with John and Mary McDougall. I'm your host and their daughter, Heather McDougall. Hi, Dad, Dr. McDougall. Nice to see you. I noticed Mom's not with us tonight.
Oh, she's got other plans, but she said I could do it alone. She trusts me. I don't know why she would, but I depend upon her heavily, especially to remember sometimes some words I forget. But anyway, that's the difference between her and I. I mean, she reads novels and I read scientific research papers. We're different people. But
We make a great team, though.
Yeah, fortunately, we make a great team. But anyway, I'll struggle through to this hour, and hopefully it'll be a worthwhile presentation. We get together on 5 o'clock every Sunday night. And for those of you who are interested in following the McDougall program, you'd like to get some advice, and I'm going to give you, just like, well, not exactly like you're my patient, because you're not. If you want to become one of the McDougall patients, you have to spend 12 days with us in the internet-based program. That's what we do now. We take care of people all over the world, and that's the only way I have official documents on you. The only other situation might be is if you spent time at our resort, which we ran for 18 years. Quit running that in March of 2020 when we were struck with the COVID pandemic and the shutdown of the entire society. So we had to stop, and we reinvented the program into a better form. Internet, 12 days. And boy, if you're missing the opportunity to join that program, you're really missing a real push forward in your health. So I'm going to encourage you as much as I can. But as you well know, the information that I've been collecting for the last 46 years is free and available for you on our website. And there are no gimmicks. If you want to get well and you want to struggle through it yourself, it's not that hard. There's a free program there. And but we're here to help you. And Dr. Lim, who's our medical director, will take care of you, just like you guys were in person through telemedicine. So, but if you're not a patient, we don't have medical records on you because you didn't come to the 12-day program we ran at St. Helena Hospital for 16 years, or the 10-day program that we ran at our resort in Santa Rosa, California for 18 years, or you're not one of our more current patients over the last, it's been more than 2 years, then you're not a patient. And so any advice you hear on this show is not professional medical advice. You need to run it by your private doctor. And, believe me, I encourage you to do it because I've got an approach for you that I know exceeds everything else you're being offered. And that is the opportunity to truly get well, to get off the drugs, to get your health back. Yeah, but one thing I want you to really understand is big changes. If you want big changes in your health, you've got to make big changes in your behavior, and particularly your eating behavior. And if you don't do that, if you're not ready to do that, that's okay. We'll work with you every Sunday night. We'll keep encouraging you along. And, eventually the time will come when you're tired of being overweight and sick. And you can see how simple and easy it is to eat the kind of food that we would recommend. Very simple food, starch-based food. In fact, yesterday's lecture, which I had a great time giving. It was a 4-hour presentation with a group of people. We had a sellout crowd, which is taking advantage of the series that we're running. And we're 3 out of 4 right now. The next part of the series will be on vitamins and minerals. And that will be in about 2 weeks from today. You can find out about that on our website. But we've already discussed 4-hour presentations each Saturday morning, recorded. You get to have the slides that I have put together, which are invaluable. And, they're extremely well worthwhile. So far, we've got 12 hours of education that would take place, and we'll finish it up in a couple of weeks with the next 4 hours. So we've covered protein, fats, and carbohydrates. And I have to say, Heather, the carbohydrate lecture was probably my favorite and probably the one I worked hardest on, because that's the focus of people's attention. That's why they call it low carb diets. They want you to focus on carbohydrates. well, I don't know. It's kind of passé to focus on protein, but that's been the pitch for so many years is you got to get your protein. You got to get your protein, even though as those of you who follow this, my work and the presentations and the website, there's never been a case of dietary protein deficiency ever described in the world literature, except during starvation. Then you become everything deficient. So it's, the fats, people are making excuses these days about how there are good fats and bad fats, and good grief. I don't care whether you think it's good or bad. The fat you eat's the fat you wear. Promotes heart disease, cancer, bleeding problems, blood clotting problems, diarrhea, all kinds of problems, greasy skin, acne. And we discuss that again in great detail, but the most fun that I think I've had so far, the vitamin and mineral lecture is a lot of fun, and I'm looking forward to giving it in a couple of weeks, has been the talk I gave yesterday morning on carbohydrates. Because you people who are being bedeviled by the low carb movement, and you don't have the information to defend it. Oh, I feel sorry for you. These are aggressive, and might I say, evil people who are promoting the very foods that are killing you and killing the planet. Bacon, butter, and brie. It started with Dr. Atkins. And we have all kinds of new low-carb keto diet promoters. And the best I can say is these people are not only misleading you, they're causing you terrible health and hurting the animals on the planet and hurting the planet itself. So get over it. Learn about the truth about carbohydrates. And I'm going to talk a little bit about this on Chef AJ's show tomorrow morning at 10 o'clock, Heather. And I'm only going to just give a little tease about it. I'm going to talk about one of the promotions of the low carb movement is there are people who survive on low carb diets, and they give the Eskimos as one example. We'll talk about the Inuit Eskimos tomorrow on Chef AJ's show, as I did extensively yesterday morning. I gave you the whole history. I gave you the evidence. I gave you the research, so you can see there's no Eskimo paradox. These people are what you eat, just like everybody else. And I had a chance to talk about a tribe called the Maasai, who have existed. They're sheep herders in Africa. They're in Kenya, that part of Africa, and they live on blood, milk, and beef, or at least from puberty on. And they put that on as an example. See. Look, the people eat a low carb diet, meat, milk, and blood, and look how healthy they are. Well, again, there's no paradox here. It's just misinformation, and I was able to help the people who attended the presentation yesterday, and I'll get a little bit of that information tomorrow. But they're going to have to work a lot harder tomorrow on Chef AJ's show to get the education that everybody really needs. You're being lied to, plain and simple. And of course, then I gave a whole bunch of examples of high carb diets. And you've been alive long enough to see it. I mean, it's not any mystery. I talk about different populations that have existed for the last, actually 2.5 million years. Talked about the Neanderthals, showed you that they were starch eaters. Even today, if you're my age, you've seen the transition that's taken place in places like Mexico and Central America, where they live on beans and rice. Corn is a primary food of people in Central America. Potatoes have also been a big part of the diet. Aztecs and Mayans are known as the people of the corn. You need to know about that. 1,300 years these societies existed on corn. They fought battles. They were strong and healthy. As I told you before, you talk about populations living on starch. How about the Incas who live in the Andes? They lived on potatoes. And I know you're young enough to, or maybe old enough to think about the people in Asia. Vietnam, Cambodia, Thailand, China, Japan. Just mentioning these people, the things come to mind is that they live on rice. They're starch eaters. The human being is a starch eater. anyway, I had fun giving like I say, it may sound like a long time to sit and listen to me, but I think everybody was entertained, and hopefully there's a few people were sitting on the edge of their chair listening to one educational point after the next that made it absolutely clear. And you ask yourself, why are you being lied to? Well, if you understood that your food, your proper food to have your health and your personal appearance was starch, what would happen to industries? Where are the big money industries? The beef industry and the dairy industry, the fish industry and the poultry industry. Yeah, they got all the money. So they're just acting just like plain old business people act. They're making sure that they have the market. And how do they make sure they have the market? Well, they buy experts. Yeah, they do. And I gave you an example of Dr. Lard. If you want to look it up on my website, you can read about Dr. Lard, a big professor at Oakland, down in Oakland, California. And I wrote about him in 2014, still stands. What would that be? 16 years later, and Dr. Lard still is Dr. Lard. He works for the dairy and the meat industry. And he lies left and right in the scientific journals, and they pay for it. You don't stand a chance. They got all the money. Anyway, that's the deal. Hey, Heather, we had a great time at your house over the Thanksgiving weekend, and we did miss last Saturday because we were all traveling, and hopefully there are enough people attending that we get some of the questions answered today. I want to start by answering a question that I answered incorrectly 2 weeks ago on the 20th when we had our session. And that was somebody else asked me about alpha lipoic acid in breast cancer. And I thought I heard alpha linolenic acid, which is one of the fats. Alpha linolenic acid is a fatty acid, and these are some of the fatty acids that promote bleeding. They suppress the immune system. They encourage cancer growth, but they're essential fats. You've got to have a little bit of them. And as opposed, the question was really about alpha lipoic acid. And Heather will put up the link to the research paper that really clarifies for you alpha lipoic acid and some of the laboratory experiments have done in terms of breast cancer. It's just in the Petri dish. It's not in a clinical setting. I've used alpha lipoic acid, which you can buy in the natural food store. I've recommended it for people with peripheral neuropathy. And there's some evidence that that alpha lipoic acid will help people with peripheral neuropathy. Some of the studies involve giving it by intravenous therapy. And then there's also some studies that involve pills or oral therapy. And, they're encouraging. And certainly I would think that it would be reasonable for you to try these supplements and don't spend a lot of money on them. Give them a fair trial. Give them like 4 months. Don't invest any more money on that. And see whether or not they'll give you an edge on peripheral neuropathy, which is where you get pain and burning and loss of sensation of your feet, often related to diabetes. But you need to know changing your diet is a far, far, far more powerful way to take care of peripheral neuropathy. But maybe you're not ready for that big change, or you've made the big change and you still need some extra help. The drug therapies out there are useless. They're costly. They have serious side effects. So don't get involved in in the pills that your doctor might offer you for peripheral neuropathies, and pretty much goes with all the pills. But there are some really good pills. Don't correct me, Heather. I always say there's some really good doctors.
Do generalize a bit.
I get a little confused. But anyway, I hope that I corrected that for you. Is alpha lipoic acid. If Heather could put it up on the chat board, I looked up rather the particular. Once I understood that I made a mistake, I looked it up and put an article up that you could at least start looking into it. It's just based on the Petri dish, the laboratory, and it shows that it may be of some positive effects. But again, ladies and gentlemen, the food, if you want to stay alive and you have breast cancer, the best way to prolong your life is to change your diet. And there's a huge research paper that if you'd attended the lecture yesterday, you'd have that paper. But It was put out in JAMA Oncology in August of 2022, where they looked at high carb diets versus low carb diets, and what kind of diet should somebody that has cancer follow? Clearly, they recommend high carb, plant food based diets. But all the research prior to that said the same darn thing. And the American Cancer Society came out in 2015, February 2015. And they told doctors they have to start using diet as part of the fundamental therapy for people who have cancer. And of course, the diet they recommended is a diet that we recommend, or at least in the same direction. They're still a little bit afraid about coming out too radical. So they tell you to cut way down on your animal foods and to way increase your grains and fruits and vegetables. But you got to understand, these people are involved in politics. They also haven't changed the diet, their own personal diets, so they can't see beyond their dinner plate. But anyway, so you want to give alpha lipoic acid a try. You can afford the experiment. Go ahead. I think it's relatively non-toxic, relatively inexpensive, but you want to get serious about getting the most out of your life, whether you have breast cancer, colon cancer, prostate cancer. My 46 years of experience has clearly shown me that the benefits are huge. But I know it's easier to go to the doctor and get all these drugs and until you start taking them. And boy, if you had to pay for them, you couldn't afford it. But your insurance company pays for it, or Medicare pays for it. What an attitude. But unfortunately, that's the way it is. But the toxic side effects of these drugs are huge. The failure is huge. So they got some new experimental cancer drugs out that, hopefully will be of advantage in terms of getting you to live longer. But, there's a lot of work to be done before we can claim success. Anyway, Heather, you got some questions? And
I have so many. Yes. Lots coming in. So let's start with the first one. This is from Kirsty K. What do you recommend for stubborn insulin resistance?
Oh God, I don't know. I recommend you follow the diet. You get the carbohydrate in, and you get the fat out. There's a whole lecture on this, free, available to you on YouTube, about diabetes and how to make the insulin work better and why insulin resistance occurs. Insulin resistance is a normal adaptation to being overweight. When you get ready for fall and winter, as we're about to do right now, what happens is the body says, hey, I got to make it through a tough winter. Maybe there's no food available. So let's gain an extra 20, 30 pounds. Good idea. But then after you gain 30, 40 pounds, the body says, hey, this is not your advantage. This is not beneficial to you. It does not promote your chances of surviving. You're going to get eaten by a saber-toothed tiger. You won't be able to get into the cave entrance. So the body puts the brakes on the activity of insulin. Insulin pushes fat into fat cells. So you develop insulin resistance, so you don't become 100 pounds, 200 pounds, 300 pounds overweight. Normal adaptation. It's not a disease. So if you're still overweight, you've got insulin resistance. If you haven't put the carbohydrate in the diet, taking the fat out, you haven't taken advantage of getting the insulin to work more efficiently and to stop the resistance that's caused by eating any kind of fat, vegetable fat, animal fat, etc. In this lecture, if you take the trouble to watch it, it's free. It's on YouTube. You just look up McDougall and diabetes. Gives you all the data, all the research. You can go look it up, and it'll explain to you how this works. So that's what you do. Have you lost all the weight? Maybe. Let me clarify here. If you've lost all the weight, then you don't have a complete problem of insulin resistance. You've got something else going on. You've got a problem of insulin insufficiency. These are people that I call type 1.5 diabetics. A type 2 diabetic, they have insulin resistance, and it's due to being overweight. You get type 2 diabetes essentially always by becoming overweight. And essentially, it's 100% curable, if it's true type 2 diabetes, by losing the weight. Whether you have bariatric surgery, whether you go on the Atkins diet, whether you get locked up in prison or you're starved, you lose the weight and the type 2 diabetes goes away 100% of the time. And then there's a condition called type 1 diabetes where the pancreas has been destroyed. Okay, you're not producing insulin. Well, this is a spectrum between type 1 and type 2, and I call this type 1.5. It's where the pancreas makes enough insulin to keep you out of the hospital, keep you from dying, to keep you from developing ketoacidosis. But it doesn't produce enough insulin to keep your blood sugar where you'd like it at a perfect level. You don't make enough insulin to stop the excessive urination, the excessive weight loss. And in that case, where you have not type 2, okay, you have type 1.5, what I do is I prescribe for my patients usually works out as a single dose of long-acting insulin once in the evening. Real easy to do. You take 20 units of Lantus or 10 units, or you'll figure it out. Your doctor will prescribe it for you, and you take this shot of insulin, and what happens is the frequent urination stops, and you stop losing an excessive amount of weight. You check your blood sugar; it might be a little bit better. That's a couple of options for you to think about is maybe you have partial pancreatic insufficiency or type 1.5 diabetes. And maybe you still are really a type 2 diabetic. You lose the weight, you'll see, no matter how you lose the weight. Bariatric surgery, keto diet, starvation, imprisonment. Just lose the excess body fat, and there's no reason for you to develop type 2 diabetes.
Great, thank you very much. Next question from Nicole. She wants to know if someone can eat rice and veggies every day and not eat any beans.
Yeah, absolutely. There's plenty of protein in rice. About 8% of the calories are protein that you get from rice. And you need about 3% of your calories as protein. A human breast milk is 5% of the calories as protein. That's the time of greatest growth in your life. Is when you're an infant. You double in size in 3 to 6 months. Your protein demands are the greatest they'll ever be. And hopefully you're at a point in life when you stop growing. I'd offer as an example, 2 billion Asians. 2 billion Asians. Before 1980, they obtained 90% of their calories from white rice. Okay? And I'm sure there are many of them that had no animal foods at all, or it was really, really infrequent, particularly when times got tough or they're less financially advantaged situations. So they were glad if you got enough rice to eat all day, and even in modern times. So it's never a problem. Rice will, as long as you get enough calories, you've got to get enough to eat. You get all the protein you need from rice. Now, when it comes to vegetables, you're looking at broccoli and lettuce and cauliflower. They're 35% to 50% of the calories that come from these green and yellow vegetables are protein. Remember, breast milk is 5% protein. And I'll just kind of end this discussion by telling you there's never been a case of dietary protein deficiency ever reported in the scientific literature. You will never find me a case except under situations of starvation. Then you're deficient in everything. So put it aside. If you got to get rid of these misunderstandings, and these misunderstandings were created by industry. I grew up with them. Unfortunately, I suffered terrible health because my parents believed that the most important nutrients were protein and calcium. Now, guess why they believe that? Even though there's never been a case of calcium deficiency ever reported on any natural diet, there's never been a case of protein deficiency ever reported, period. Why do you think my parents learned that calcium and protein were the most important nutrients? It's called the dairy industry. It's called the beef industry and the poultry industry and the fish industry. You see, if you knew the truth, then they would lose marketplace. Not that they're trying to make you sick. They're just doing business. Come on now. And Anyway, those aren't the most important nutrients. The most important nutrients are your B vitamins, which are made by plants, except for B12, which we're going to discuss about in 2 weeks in the last of the series, which you could still join. You could still join the series. So all your B vitamins are made by plants. Vitamin C, guess what? Come on now, where does vitamin C come from? Okay, so the orange juice companies taught you where vitamin C comes from. It comes from fruits and vegetables. And vitamin D, which we're going to talk about, is not a vitamin. It's a hormone made by sunlight exposure to the skin. Vitamin E, it's made by plants. Folic acid, plants, folic acid made by plants. So, if you are following a plant food deficient diet, which a keto diet can easily be, they've made efforts, they've made apologies for some of their original teachings, which have put people in at great risk of developing serious nutritional deficiencies. And they apologize by, okay, you got to eat all this protein, all this meat, and so on, but you got to eat green and yellow vegetables, low carb green and yellow vegetables. It's just you don't stand a chance, ladies and gentlemen. So anyway, that's why we're here. We're here at 5 o'clock every Sunday night to help you have a better understanding of things. If you don't believe me, my medical recommendations, the things I tell you about nutrition, then challenge me. I've been at this for 46 years. I've written 13 national best-selling books on the subject. I've taken care of over 12,000 people personally. So I think I'm up for the challenge. You got to be polite now. You can't be one of these nasty SOBs that's trying to get attention just by being loud. Offer me the challenge. Show me where I'm wrong. I don't want to teach you anything that isn't correct. But I have success on my side, and that is that our patients get well. They don't get drugged. We get 90% of people off their medications, particularly diabetic and blood pressure medications. So, save you a ton of money too with this dietary change. And it's good for the planet. Come on, ladies and gentlemen. How long are we going to put up with what's going on with the fossil fuel industry and the cattle industry and the dairy industry? They're killing our home. Anyway, the next question.
Okay. This next one is from Amal. They would like to know how much time it takes to recover from autoimmune diseases when following the starch solution.
Usually about 4 to 7 days. You start to see improvement in about 4. It takes that long to clear the bowel out of the foods that are causing the autoimmune reactions. It takes about 4 to 7 days. And I ask people not to give up for 4 months. You go through a series of dietary progressions. You start with the basic McDougall diet without wheat, barley, and rye, which deals with the celiac problem. And that's a good place to start. And so what do you eat? You can't eat wheat, barley, and rye. How about potatoes and sweet potatoes? How about peas and beans and corn and rice and so on? I mean, tons of starches out there to eat. And then as a last step, you go to my May 2014 newsletter on our website, and you look up the elimination diet, which is an article about 10 people with severe autoimmune diseases. Arthritis is primarily, various kinds of arthritis, inflammatory arthritis. Now, when you're talking about bowel inflammatory diseases, that takes a little longer because the intestinal tract gets so thickened and so inflamed that I wouldn't get discouraged. I would give it at least a month before you said, you better start looking for some other help. But I don't think you'll have to do that. And what would be some other help? Well, I've told you many times, and I'll tell you again, the ultimate elimination diet eliminates most of the antigens which incite autoimmune diseases. And these antigens are animal proteins primarily. The ultimate elimination program that eliminates all cholesterol, all fat, all poisons from the environment is a water fast program. And the one that I would recommend people take advantage of is True North in Santa Rosa, California. These people have been friends of mine for 35 years. The results of water fasting are phenomenal. But you need to know is when you're done with the water fast, what they do is they teach you the McDougall diet. They tell you not to eat salt and sugar, which we tell you to do to make the program easier. But basically, you're going to end up with a McDougall diet. And I have to tell you that in my experience, there are extremely few people who have to take that last step. But it's available for you if you aren't getting the results you're looking for. So in 4 to 7 days, you ought to start feeling better. After you follow the diet strictly, you stop going out to eat. You make sure that all of the packaged food is correct. If you're going to eat packaged food, which you shouldn't. And simplicity is the key to success as far as the program goes. I presented the last slide I presented yesterday was really one that I hadn't seen for probably 15 years. It was based upon an advanced study weekend that we did, where I did a discussion of what the ultimate diet is, the ultimate diet. What could I recommend for people who, really didn't want to put the work into it, make it as simple as possible, would cover the most conditions possible. What could that diet be? So I went through a whole slide presentation. It's be a fun one to do again. I will do it again. And I talked about the problems with wheat, barley, and rye, celiac disease. So they wouldn't be in the program. I talked about how white potatoes develop, when they're spoiled, develop a solanine poisoning, the green stuff under the skin. So yeah, they were eliminated. I talked about beans, peas, and lentils being too high in protein for the body to handle under various conditions, like liver failure or kidney failure. So they're out of the picture. And then when I went through this whole discussion about different categories of starches, and finally ended up as the target diet. In other words, the least chance of you having any errors. And this becomes important when people have attended our clinic now and in the past. Sometimes they're really troubled. They're dying of heart disease. They're dying of cancer. They're overwhelmed with problems with the family. They just really haven't been able to relax and absorb what we try and teach. And occasionally somebody gets to the end of the program and they say, look, I don't know how to fix the food. What can I do? And what I say to them is, look, this is what you need to do until you figure out what to do as far as the whole program is concerned. The target diet, the optimal diet, is a diet based upon sweet potatoes with the addition of green, yellow, purple, and orange vegetables. These are non-starchy vegetables. No fruits, just sweet potatoes and green and yellow vegetables. Eat as much as you want. You have the best chance of dealing with heart disease, kidney failure, autoimmune diseases, etc. And by the way, that happens to be one of our favorite meals these days. Barry makes, we get these delicious sweet potatoes at Whole Foods or Fred Meyer's or New Seasons. Every market has them. And you get some nice big ones and you cook them properly. And by the time they get done and they have this kind of juice that comes out of them, and they're soft and really sweet in taste. And probably 2-3 times every couple of weeks. That's one of our favorite meals, not because it's an optimal nutrition, it's because we love it. So, that's what you ought to do. If you think you can't get well, you've tried everything else, hey, give yourself a couple of weeks on sweet potatoes and green and yellow vegetables. And really don't give up for 4 months. 4 months, the body heals in 3 to 4 months. I've seen it. I'm a medical doctor. I used to be in charge of the Honolulu, the Queens Medical Center emergency room in Honolulu when I was a young man. And I saw people terribly, terribly injured in car accidents, motorcycle accidents, gunshot wounds, come to the ER almost dead, broken bones, holes in their body, scrapes and cuts, and just, you couldn't believe they were going to live. And as a young doctor and in my training, I had a chance to follow up with the, maybe have a walker, certainly some crutches, some help. And 3 weeks, they're ready to go home. Yeah, they are. And, a few days later, maybe they can get rid of the walker and just get around on crutches. And then 3-4 months later, they're healed. As long as they don't get shot again or fall off their motorcycle again, in other words, get a repeat injury, it takes about 3-4 months for the body to heal itself. Anybody that's telling you different doesn't understand natural healing and doesn't understand the miracle of the human body. So anyway, next, Heather.
Thank you.
I know I get a little away, but I'll try and keep it quiet.
I love it. You have so much to say on every topic. It's great. Thank you. Next question. Nina wants to know why you tell us to limit our fruit consumption.
Oh, it's because you love fruit. Fruit is really good. I, of course, being back in Santa Rosa this past week, spending time with Heather, brought back the memory of the nectarine tree that we used to have right outside of our office. And only came in bloom, for a week every fall. And I was out there with a grocery basket, and I'd pick 20 pounds of nectarines. And I'd sit down, I'd eat 20 nectarines at a time. Well, that's a lot of simple sugar. But I only got to do that once in a while. And that's because of the nectarine tree. But in this day and age, with transportation, et cetera, and wealth, you can have your nectarine tree in bloom all year long at Safeway or Target or New Seasons or Whole Foods. The tree is always in bloom, folks. So it's really familiar, really tastes good, and you can overdo it. Simple sugars are calories. They count. They'll slow your weight loss. Simple sugars, whether they're white sugar, brown sugar, molasses, agave, or even fruit sugars, only temporarily satisfy the hunger drive. You'll be back looking for food again within minutes after eating these simple sugars. So that's why I recommend starch. Now, there are a couple other things that come with simple sugars. One is if it's really simple sugar, like brown sugar, white sugar, molasses, honey. I mean, that's just pure old sugar. What you're talking about empty calories. These are calories that have to be digested by the body. And in a sense, what they have to do is they have to get the nutrients for digestion from other parts of your meal. You have to get the vitamins and the minerals, et cetera, from other parts of your meal, because all they are is sugar. They're empty calories. So in a sense, simple sugars rob your body of of nutrients. Rob your body of nutrients. So first of all, you start with the problem of simple sugars being empty calories. And even fruit is relatively, I'm going a little too far there. Fruits have a lot of redeeming qualities to it. But, when we're talking about further refining, you get into more and more simple sugar. Simple sugar will rot your teeth. Even fruit sugars, if you consume them too much, they feed the bacteria that cause caries. One of the more troubling things for families is what they call baby bottle tooth decay, which is where the infant, either on the breast or with the bottle, which is much worse. The interaction between the mother and the baby on the breast rarely results in this, but it can. The baby can lose their front teeth by mother and baby being attached for too long. But it's called baby bottle tooth decay. And what happens is the infant loses their front teeth because of the constant drip of milk sugar on their teeth. So you got the empty calories, you've got the rotten teeth, and then the third thing is that simple sugars, even fruit, will raise triglycerides. And these are the fats in your blood. And the people with high triglycerides have high rates of heart disease. But, the experiments done on raising triglycerides with simple sugars or even starches have one common quality, and that is that they overfeed their subjects. They make them eat more food than they desire. They're overstuffed. And in that way, you can show that triglycerides go up, that's the fats in the blood, by eating starches. But if you ask people in an experiment to eat ad libitum, in other words, just as much as they want, when they're full, they stop eating, then the triglycerides don't go up. So why would somebody design the experiment so the triglycerides go up? Guess why? That's right. They want to make sure you consider the problem in your diet, sugar. That's what the meat, and the dairy, and the fish, the poultry industry want you to know, is that sugar is bad. But sugar is really the diet of the human being. You can run into problems with simple sugars. Don't misunderstand me. I know a lot of people have out there, they've tried to, behind my back, they've tried to say, oh, Dr. McDougall, he recommends a bowl of cereal with a half a box of sugar on it. No, I don't. I might recommend a great big bowl of oatmeal with a teaspoon of sugar on it. Yeah. Anyway, that's why you need to keep the fruits reasonable. It's just, use them for a dessert. Make sure they're whole fruits, and appreciate the fact that they are really tasty. You can overdo it.
Okay, great. Thank you. This next question's from Jenny. She wants to know why she's craving more fats since she began swimming. She's lost 40 pounds, but still has a lot to go.
Yeah. I don't know. I don't know why the human appetite does not appreciate fat. Okay, there's no feedback. When you eat sugar, and this has been proved in various experiments, and if you read the McDougall program of maximum weight loss, I deal with this to some extent. If you feed people sugar, carbohydrates, starch, simple sugar, what happens is the body recognizes this, and the hunger drive is satisfied. When you feed people fat, the body doesn't recognize it. You just keep eating and eating and eating. So I don't know why you desire the fat. Maybe you're just not eating enough food. I mean, if you're swimming out there and you're expending a lot of calories and you're not eating enough, you're trying to eat the same amount of food you used to eat before we went on our diet, then I understand you're hungry, but you're not going to get the satisfaction. And this was done by Susan Holt, the research papers. And if you'd attended this series we did yesterday, you would have had some of Susan Holt's work. Susan Holt, she compared this, she developed something called the Satiety Index. She's, I believe, from Canada or Australia. But she developed this satiety, and look it up on Google. I mean, good grief! In this day and age, you can look up Susan Holt and the Satiety Index. I think it's published in the European Journal of Nutrition. What she did is she took subjects and she fed them various foods, and she measured the satisfaction. And what she found is that starches like potatoes were 2 or 3 times more satisfying than meat or dairy. Potatoes were 7 times more satisfying than croissants. It's you want to satisfy the hunger drive, then a potato is the most satisfying of all foods I could think about you eating. And so I would just, double up on your food intake, especially if you're being active. It's not going to slow your weight loss down. And it may cause you to stay with the program longer, because suffering the pain of hunger is one of the primary reasons people stop dieting. Not with our program, because we never put a limit on the amount of food you eat, only the kind of food you eat. You eat about 70 to 90% of your food is starch. Be sweet potatoes, rice, corn, pastas, whole grain. And the remainder of the calories that you consume are fruits and vegetables. So anyway, I think you'll get it straightened around. Just think about it. Be a little patient. Keep up the swimming. That's a way to burn calories and get yourself in good shape faster.
Great, thank you. Next question. This is from Tanny. She would like to know if the McDougall diet helps with degenerative disc disease.
Well, it can, We do really well with inflammatory arthritis, like rheumatoid lupus, ankylosing spondylitis, psoriatic arthritis. People respond really quickly, usually within 5 to 7 days, as I told you. Degenerative disease is wear and tear. It's wear and tear arthritis. But people who have this wear and tear arthritis or osteoarthritis, they also often have an inflammatory component, which with dietary change, that will be helped. The reason that joints degenerate is because they're being poorly nourished throughout a lifetime. And because of the poor nourishment, and I'll tell you where that poor nourishment comes from in just a minute. Because of the poor nourishment throughout a lifetime, the joints can't resist even simple activity like, writing or sewing. Poorly nourished joints, older people, they have crooked, bent, Hebridean's nodes all over the place. They're just, terrible degeneration takes place. Whereas if you take a look at people who live on starch-based diets, and I can show you the research on Africans. In fact, you can find it yourself. You can look at the YouTube right when we're done. You can look up McDougall and autoimmune disease, and I discuss the studies on osteoarthritis. I believe in that lecture. Anyway, you can find a lecture I gave on arthritis where I do discuss this data. But here you have Africans in rural Africa living on the McDougall diet, essentially, starch-based diet. Currently on maize, they eat a lot of corn. And prior to that, they ate a lot of root vegetables and grasses and seeds and quite varied diet. And these people, they work in the field like hours all day long, toiling in the field. They carry heavy baskets on their head, and they don't have any degenerative arthritis. None. So they don't live old enough. Well, back when these articles were published, 10% of the African population lived beyond the age of 60. Now, there's another understanding that you need to have, and it has to do with circulation to the back. And this is discussed in some articles that, my favorite medical articles, but you can look it up. Look up the degenerative disc disease and atherosclerosis. Okay, what you'll find is there's studies where they looked at autopsies of people who have degenerative disc disease. And they'll find they have terrible atherosclerosis in the arteries that supply the backbone. And as a result, the discs don't hold up. They degenerate. If you have a ruptured disc or you have a degenerative disc disease, you'll hear from your doctor, you have degenerative disc disease. Well, what you ask is, you say, look, doctor, it's not like I picked up a Volkswagen or a piano. I just turned, I just twisted, I just took a step, and that disc popped. It was terribly degenerated. How did it get degenerated? You call it degenerative disc disease. Come on, tell me why it got degenerated. Well, you can figure out why it got degenerated if you look up the study of the vasculature, atherosclerosis, on the lumbar spine. You'll find the articles. I made them easily available for people to attend our programs. But with a little work, you can have everything we talk about for free. The program is free, 12-day program is free on our website. But if you're tired of being sick and overweight, struggling along, wasting time with your family, wasting years of your life, let us help you. That's what we're here for, is to help you. And you sign up for the next 12-day program, which is coming up in January, isn't it, Heather?
Yeah, January 13th.
Yeah. So, you've got friends, you've got relatives, you're going to be meeting with them over holiday times. Once in a while, somebody will say, hey, you look so trim and young and healthy. How'd you get that way? Some of them will say, I don't want to hear anymore. Once you tell them what you're doing. But there'll be some of them who will listen to you, and they will credit you the rest of their life for saving their life. And you'll feel so good about it. So send them to us. Let us help you and your friends. That's what we do. But it's all free. I took the attitude that my life was saved half a century ago. And I'm not going to tell that story tonight. But, we have an obligation to share with other people. And besides that, the feedback we get is just phenomenal. It feels so good to help other people. And we do, with the McDougall program, which basically is the diet that 99.99999% of the people who ever walked this earth have followed. The McDougall program results in health and healing. The problem is the food. You're sick because you're suffering from malnourishment due to the wrong foods. You're eating like a calf, a baby cow. You're eating like a kitty cat. You're eating foods that you never feed your animals. You get arrested by the Humane Society if you fed them cakes and ice cream and cookies and things like that. We can fix you. It's easy. But you got to be willing to get started. And, we'll take it, we'll help you. And you will do well. There are people who come to our programs for it's been like 36 years now. I've been running programs. They say it's the best money and time they ever spent. And it is. And most of them, they can learn it in just limited experiences, but we're always there for you. Good grief. We have people who come back to the program 2 or 3 times, and they consistently say, we learned more the second time, and it took us the third time to finally get it all understood, but it was worth every penny, every moment I spent. So what's your life worth? What is your life worth? I know it's worth the trouble to learn the truth. And industry doesn't want you to learn the truth. They want you to keep buying their garbage. They want you buying potatoes and sweet potatoes and rice and corn for pennies, for calories. They want you to buy, the pork chops and the eggs and the brie cheese and Parmesan, whatever. Get real. It's the money. In the hospital system, they're happy too, because that's how they get their business. Pharmaceutical companies are thrilled. Every one of these ads that I see about autoimmune diseases on TV and these drugs that knock out your immune system, they ought to be required to give a 30-second presentation prior to the ad that explains to these people with ulcerative colitis, Crohn's disease, rheumatoid arthritis, etc., that if they change their diet, they'll get well. Maybe the future of politics will require that kind of limitation on advertisement. Just like, there was a time when you could advertise cigarettes on TV, and Congress got in there and stopped it. There was a time when we were able to promote baby formula rather than breastfeeding. That was stopped. Legislation can be passed that will put these industries in line, and they need to be. They won't do it on their own, not the food industries, not the pharmaceutical industries, not the fossil fuel industries. They must be put in their place. Yes, I'm getting a little carried away.
That's okay. It's good. We love to hear it. Okay, we've got 7 minutes and a ton of questions that we're never going to get to, but I'm going to try to get through a few more.
And then
Chris would like to know what your opinion is on vitamin K2.
Well, that's kind of interesting, because there's been some criticism about a vegan diet. Vitamin K2, by the way, comes from green and yellow vegetables and also fermented vegetables. It's high in those products. So it's a natural vitamin that comes from plants. But the argument has been that I don't know the full argument, but that when you take a supplement with K2, that you provide an element that may be deficient in a vegan diet if it doesn't contain enough green and yellow vegetables or fermented vegetables. And so there's a big marketing campaign to take K2. I've looked into it. I see no reason for you not to include it in your program. I'm not going to recommend it. I don't have that level of information. It's relatively harmless, relatively inexpensive. And, if you want to cover all bases, which many of you do, then you would add a K2 supplement. But you need to take care of the basic problem first. Loss of bone is due to eating acidic foods, animal foods, and the bones must dissolve to neutralize the acid. That's how you get osteoporosis, is by eating meat and cheese and fish. These are high protein, high amino acid foods, high acid foods. They put a huge acid load into your system, and your bones are the primary buffering system of the body. Every medical student learns that. I learned that 55 years ago in medical school, and I guarantee you, any student today that goes through their physiology class learns that the bones are the primary buffering system of the body. Now, our diet is an alkaline diet. In other words, we provide foods that produce a non-acidic environment, so the bones don't have to cause this kind of reaction. There are a couple other components to keeping the bones strong that I want to mention. One is moderate exercise, but be careful. The reason I believe that some of the research is showing in populations that vegans have more fractures is vegans feel better. They exercise more. They're out on their bikes. They're running, as opposed to somebody who's a couch potato sitting around eating potato chips and pork rinds. That's where I think the observations come from. So, I know you're starting to hear a lot about it. And the way you make sure you have the bones stay healthy is you get sunshine, because you need vitamin D, which is a hormone. It's toxic when you take it as shots and pills. It increases your risk of fractures. And you've heard me lecture about that, and you will in 2 weeks when I give the lecture on vitamins. So you get some sunshine, not too much, just enough, depends upon skin tone, depends upon latitude. You get some reasonable amount of exercise, not too much, be careful. How many of your friends are in the hospital or on crutches because they got hit by a car when they're out bicycling, or they stepped in a rut when they're out running their marathon? Do something safe and eat a alkaline diet. That's how you do it. That's the basis. If you want to, focus on more green yellow vegetables, get the K2. You want to add tempeh or miso or other fermented vegetables which are higher in K2. Go ahead. If you want to add a supplement pill that you buy from many people willing to sell you these K2 pills. I think it's not ridiculous, and then you cover all bases. So, that's what I would say.
Great, thank you. Next question, would following a whole food plant-based McDougall diet help shrink your prostate?
No, I don't think so, Heather. I've taken care of a lot of men over the last 46 years. And what happens is the prostatic hyperplasia, which, by the way, if you go to the McDougall website, you look under hot topics, there's a whole hot topic section on prostatic hyperplasia. Okay, and then there's an article about enlarged prostates that occur in men, always men. And it occurs as a consequence of chronic inflammation of the prostate, which occurs through years and years and years of being alive, and also years and years of eating the wrong foods. And what you do is you end up laying down scar tissue, which is very hard to reverse in the prostate gland. And then what happens is the prostate gland enlarges, and the urethra passes through the prostate gland. So when you pass your water from the bladder out the urinary tract, out the penis, into the toilet, this little tube that passes through the prostate gland gets squeezed. And so you can't urinate very good. And it can be a serious problem. I've had some very strong vegan friends. I can remember, one of my good friends in Hawaii, who was about 75 years old, my age, who ended up in the hospital because he refused to get, the necessary treatment, and he had severe prostatism. And he ended up in the hospital. He ended up with water backed up to his kidneys, which is called a hydronephrosis. And it was a really tough situation for this man. He had to have a surgical intervention at that time. But, in the meantime, when you don't have the flow that you had when you were a kid, peeing like a racehorse, there are some things you could do. There are various supplements, and they're discussed in the article. Go to the website, Hot Topics, under prostatic hyperplasia. It tells you about different ways of taking herbal medicines like saw palmetto. And there are others too that you ought to look into, which help shrink the prostate. Next thing you do is you take drugs, alpha adrenergic blockers, which doctors prescribe. I'm not thrilled. I haven't found a lot of people help, but in the next step to get relief, that would be the way to go. And then you can take anti-testosterone drugs that block the activity of testosterone. That helps shrink the prostate a little bit. So there's a couple of treatments that you might consider before you have surgical intervention. you know, you really don't want to get to the point that some people get to, which was the only option available back in my days. I thought this went out with torture chambers in the medieval ages, but they still do it. They're called TURPs, transurethral prostate resections, where they take a knife and they stick it up your penis and they scrape your prostate tissue, and you bleed terrible after this surgery, and you have a catheter put in your bladder for days. And I remember watching the bloody urine come out at the bedside of people who went through this surgery. And finally, after about a week, maybe you're able to go home with a catheter, with an indwelling catheter, and then you heal, and then things get better, but you never have a normal sex life. The sperm, they don't ejaculate out the front of the penis. You develop retroactive ejaculations, where when you ejaculate back into your bladder. Then repeat the next time, there's your ejaculate. So that you can expect to have done with this procedure. Then there are what we call minimal surgeries that can be done. The one I used to like, I can't find people who are doing it much anymore. It was called microwave transurethral thermography, prostate, let's say transurethral microwave thermal therapy. And what they did is they stuck a catheter off the penis, urethra, and the tip of the catheter, they had a microwave unit on the end of the catheter. And so they turned this microwave on, and it would heat the prostate and shrink it away. Very effective, very simple. You go home afterwards. I haven't been able to find that therapy available, but it's discussed in this newsletter I keep referring to. Now they're doing lasers. They're called minimal surgeries, and they've got a new way that's advertised on TV. I'm sure it's very profitable, where they put a splint in your urethra, and you end up with this splint. And I haven't been interested enough myself to look into it. Having one of these splint procedures done. But, you're not going to reverse it with a diet. I'm sorry. You're going to need some extra help.
Okay, thank you. It's 6:03. We've run out of time. That was great. Thanks, Dad, Dr. McDougall.
It was a pleasure. I'm going to be on Chef AJ's show tomorrow, 10 o'clock Pacific time. You can find her on YouTube. And then we have... I think we'll close by, if you give the dates for the next program, Heather.
Yeah, so our next event is the final event in our Truth About Food series, and that's all about vitamins and supplements. That's on December 17th. And then we have our 12-day course that starts January 13th, 2023.
Okay, we're here to help you. We'll be back next Sunday night.
5 p.m. Pacific.
5 p.m. Pacific, Sunday night, free. Bring your friends, your relatives, and just say, we want you to meet Dr. John McDougall and his family. They've got another way of looking at things that might interest you. Thank you, Heather.
Thanks, Dad. That was fun. Thanks, everyone, for being here.